Welcome to another session of Epidemiology and Public Health. Today, what I'm going to talk about is one of the key concepts in epidemiology, which we need to understand when we talk about communicable diseases. So, today, we are going to look at the chain of infection. Let's look at the terminologies involved in this concept. The first term which we all need to look at is the term infection. Now, many a times we as students or health professionals do try to make a mistake between understanding an infection and a disease. So let me try and explain what is the meaning of the word infection. Infection is an invasion of and multiplication by pathogenic organisms which are microscopic in appearance, can be seen only by a microscope, and these once entered into the body cause various changes at the cellular and the tissue level to cause injury. The processes by which these organisms cause damage may differ from organism to organism. So the point to remember in this definition is the words invasion by and multiplication of. These two terminologies are quite important when we talk about the word infection. Now, as we all know, what is a chain? A chain looks something like this, wherein we have interlocking elements which are linked to each other and they form one unit known as a chain. Now, when we talk about infection, it is also considered in the form of a chain, which also implies that it has got various elements within it and a stepwise process to check whether infection will occur or not. What I mean by this is understanding this chain is quite important, because if we want to curtail the infection or get away with the infection, we need to have a break in this chain. Once the links are broken, the infection is gone. Right. Now, since I mentioned earlier that we do make mistakes between understanding what's an infection and a disease. Infection is nothing but harboring the organism in our body. But disease is the process in which the symptoms of that particular infection are seen by others, and signs may be elicited by physicians or the doctors concerned with treating the disease. So that's the basic difference between infection and disease. Let's look at an example. Mycobacterium tuberculosis, the organism which is present everywhere, is also present in our lungs. So, does it mean that having Mycobacterium tuberculosis in our lungs, we have the disease? We all are suffering from the disease? The answer is no. The reason being, this organism is there in our lungs as we inhale in this organism when we breathe in air, as it is present all over, as we call it as ubiquitous, right? But having the organism in the lungs doesn't mean that I'm going to show symptoms and or signs of tuberculosis. If I'm not coughing, if I'm not having fever or night sweats or any loss of appetite or loss of weight, means that I'm not suffering from tuberculosis, though the organism may be there in my lungs. What may make it produce the disease is dependent on the epidemiological triad, which we have discussed in another session. So whether a person will show the symptoms of the disease or not is governed by not only the presence of organism in the body, but also by other factors. So once an organism enters into our body, it may initiate different processes through which it may manifest as a disease. As I said, having the organism in the body doesn't always mean that you are going to show the symptoms. So that results in causing various types of infection. So let's look at what are the different types of infection. I will give you examples of each of these types. One type of infection is known as colonization. Colonization is nothing but forming colonies within different areas of the body. The best example of which is the organism, the bacterium Staphylococcus aureus. Now, this Staphylococcus aureus is present at any given time in our nasal cavity and the nasopharyngeal apparatus of our body. But it doesn't always cause the disease. It doesn't always cause abscesses or kind of pus drainage from our nose. Only if conditions prevail, it may result in disease. So colonization is one type of infection. Another type of infection which we look at is latent, or what we call as hidden type of infection. Now the best example of this kind of infection is polio. So poliovirus can gain entry into our body through water, through contaminated water or contaminated food, and it can result in a hidden kind of an infection. It will remain in the intestines, but it may not show any apparent disease. So this is what is known as latent or hidden. Another example of latent, classic example is herpes simplex virus. So what I mean is, once we suffer from the disease chickenpox, the virus causing this particular disease may remain latent in our nervous system, and if conditions are suitable, it might relapse. It may show up as another infection or disease. And the other variety of infection is manifest or clinical infection, which can in other terms be defined as disease. So once an infection manifests or shows symptoms, it is considered to be no longer an infection but a disease. Now there is another variety of classifying infections: acute, subacute and chronic. Acute, as the word implies, it means immediate manifestation of symptoms once the infection occurs, and with treatment it is going to subside. Subacute means some form of the disease shows up but the organism remains latent in our body. Whereas chronic means once a person has been cured of an acute infection, the organism may still harbor in our body at lower levels, and it may show up again as a disease if conditions are suitable. So in a nutshell, what we have discussed till now is what is infection and what are the different types of infection. Now the aim of today's session is basically to talk about the chain of infection. So what I mean by chain is there are various elements. So let's look at what are these elements. In the figure which you can see here, the elements of the chain of infection are a source or a reservoir, a mode of transmission, and a susceptible host, as you can see in the figure. Now, what do I mean by a source or a reservoir? Now, these two terminologies again are quite important to be understood when we understand the chain of infection. So, what's a source? A source could be a person, an animal, an object, or a substance from which an infectious agent can be disseminated to the susceptible host. Susceptible host is the person who is likely to get invaded by the infectious agent or the organism. So source will do nothing but it will help in transmission of the infectious agent to the susceptible host. Then what's a reservoir? These are two different things. Reservoir could be a plant, a person, an animal, an arthropod, that means an insect, or any other substance in which the infectious agent will do two things. It will live, it will survive, and also multiply before it gets transmitted to the susceptible host. So the basic difference between a source and a reservoir is, in a source of infection, the infectious agent is not going to undergo any change. No multiplication, no development. However, in a reservoir, the infectious agent will definitely undergo some change. Either it will increase in number or it will change its developmental stage from one to other. So, from a source or a reservoir, an infectious agent can be transmitted to a susceptible host. But what remains in between, as you can see from the figure, is the mode of transmission. Mode of transmission is nothing but the mechanism by which the infectious agent can spread from the source or reservoir to the susceptible host, or the infection can spread from the susceptible host to other susceptible hosts. So this is what is mode of transmission. Now we will look into what are the different modes of transmission. But before that, as I mentioned in the definition of a source and a reservoir, the source could be either a person, an animal, an insect, an arthropod, an inanimate object, or just a substance which has the capacity to retain the infectious agent and help to transmit it to the susceptible host. Now, there's one more terminology which we need to look at when we talk about transmission of the infectious agent from the source or reservoir to the to the susceptible host. Now, how does the infectious agent leave the source or the reservoir? And that is known as the portal of exit. The channel through which the infectious agent leaves the source or the reservoir is known as the portal of exit. So, for example, if it's a mosquito who is going to transmit a virus to the susceptible host, the portal of exit of that particular organism from the mosquito is going to be the skin or the bite of the mosquito to the susceptible host. Now, for the susceptible host, the infectious agent needs to gain an entry through something which is known as the portal of entry. So, the portal of entry is with reference to the susceptible host, whereas the portal of exit is with reference to the source or the reservoir. What remains in between is the mode of transmission. Now, let's look at what are the different modes of transmission. Now, this is quite important for us to understand in order to understand how infectious agents can be transmitted from the source to the host. Now, there are two main mechanisms of spread of infection. One is known as the direct method and the other one is known as indirect method. When we talk of the direct method, it means directly the infectious agent can be spread from one person to other or from the source to the susceptible host. Now, this mode of transmission is quite important in the sense that infections can spread very easily via a direct mode of spread. Now, in the direct mode of spread also we have different varieties. So, the first and the most important is direct contact. So, diseases which are spread by direct contact, also known as contagious diseases, are having the mode of transmission as direct contact. And the best example of this is scabies. Scabies is an infection of the skin caused by a parasite, and this parasite causes open wounds on the hands or maybe the feet or the involved parts of the body. Now, if a person who has scabies comes in direct contact or shakes hand with another person, it is likely that the organism can be spread from that infected person to another person who may be susceptible and can be suffering from the disease later. So, this is an example of direct contact. Another example is droplet spread, the one which is very common. Whenever we go outside, people just sneeze, and if they don't take care of covering their mouth while sneezing, the droplets which are spread through that sneezing activity could enter into another person's body, and if that person is susceptible, that person may suffer from symptoms of the disease. So, that's droplet spread. So, what causes sneezing and what comes out, the secretions, they form small droplets and they can spread from the person who's just had the activity of sneezing to another person who is standing next to him. Another example or another type of direct mode is inoculation into skin. Now, this is something wherein if you get hit by a thorn and the thorn enters into your skin, what can happen is if there are spores of tetanus onto that thorn, it can gain entry into your body, or if there is another infectious parasite which is there onto that thorn, it can enter into your body. So, if anything which gets injected into your skin can also be considered as a direct method of transmission. Another example of direct mode of transmission is transplacental, which is also known as the vertical route, wherein the infection can spread from the mother to the fetus through the placenta and the umbilical cord. So, this is known as a vertical mode of transmission. So, as we saw just now, we saw the direct modes of transmission, different types. Let's move on to indirect. Now, in the indirect variety, we have got several terminologies to understand. The first example of indirect mode is through airborne route. That means through air or through droplets. Now, you may ask me, you mentioned about droplet spread in direct mode. How can it also be included as a part of indirect mode? Now, the basic difference between the droplets in the direct mode of transmission and the droplets in the indirect mode of transmission is the distance through which they get transmitted. So, what is said is, for the direct mode of transmission, droplet spread is considered to be when the distance between the person who is infected and the susceptible host is less than 3 feet. Whereas, For indirect mode, the droplets which are considered, they also get divided into smaller droplets known as droplet nuclei. They become very, very small. And when they become very, very small, they become very light, and they can be taken away by air through kilometers. So the potential of the droplet nuclei is to spread from one area to other and indirectly get transmitted into another person's body. So that's what I mean by droplet nuclei, an indirect mode of transmission. Now, if we move on to another mode of transmission in the indirect variety, we have the vector-borne transmission. Now, vector is another important term when we talk about infectious diseases. Vector is an animal or an arthropod or an insect which has got a capability of harboring the organism in their body, allowing it to multiply and or develop, and transmitting it to the susceptible host. So the examples of vector-borne transmission are diseases spread by mosquitoes or by other parasites, or we have the flies. These can become examples, or bees, which can become examples of vector-borne diseases. The classic example of vector-borne disease is dengue and malaria, wherein the mosquito, the specific type of mosquito, it is Aedes for dengue and Anopheles for malaria, which is going to act as the vector to transmit the infectious agent to the susceptible host. So that's vector-borne. Another type of indirect mode is vehicle-borne transmission. Vehicle is nothing but that particular thing which will help the infectious agent get transported into the body of the susceptible host. As we all know, we have to travel by bus or by train or by our own car or bicycle to our workplace. So that's what is meant by a vehicle. So the examples of vehicle-borne transmission are air, water, and soil. So anything which gets transmitted through air, especially agents causing respiratory infections, we call it as a vehicle-borne transmission. And the last variety of indirect mode of transmission is what we call as fomites. Or what are fomites? Are basically inanimate object on which the infectious agent will be there, and through them, if we handle those fomites, we are likely to suffer from infection if we are susceptible. So these are basically examples of indirect modes of transmission. So to summarize, for in the chain of infection, we have got the source or the reservoir, the mode of transmission, and the susceptible host. For the source or the reservoir to transmit the infection, it needs a portal of exit through which the infectious agent will be released, and through a specified mode of transmission, let it be direct or indirect, it will be transmitted to the susceptible host. To gain entry into the susceptible host, there is a portal of entry needed. So a susceptible host through the defined portal of entry will give access to the infectious agent, and that's how the chain is completed. So in order to control an infectious disease, we need to look at this chain, and we need to break the links in the chain in order to achieve infection control, which we will look at in another session. So this is all from me today. Thank you very much. Please give your comments and do subscribe. Thank you. Bye.